On February 1, 2016, the World Health Organization declared a public health emergency of international concern over the Zika virus. Here's everything we know so far. In 1947, in the Zika forest of Uganda, the first samples of the virus were isolated from a captive rhesus monkey. The next year, scientists recovered the virus from an Aedes africanus mosquito in the same forest. 4 years later, the first cases of the Zika virus are found in humans, both in Uganda and the United Republic of Tanzania. In 2007, the first large outbreak of Zika is found on the Pacific island of Yap, with 185 suspected cases. Prior to this, only 14 cases of Zika had ever been documented. On March 2, 2015, Brazil notified the World Health Organization of an illness causing skin rashes in the northeastern states. Zika was not a suspect at this point, so patients were not tested for it. As of February 2016, Brazilian national authorities estimate between 500,000 and 1.5 million cases of the Zika virus, and a total of 39 countries reporting local circulation of the disease. Zika spreads when an infected person is bitten by an Aedes mosquito, and then the infected mosquito goes on to bite someone else. If a pregnant mother contracts the virus, it can be passed on to her unborn child. Although the virus has been spreading quickly, only about 1 in 5 people who contract Zika actually become sick. The symptoms of Zika are generally mild, including fever, skin rash, red eyes, muscle and joint pain, and headache. The symptoms generally clear up within 2 to 7 days and can be treated with some common pain and fever medicines. What's troubling about Zika is the increase in a disease known as microcephaly in some of the countries that have known outbreaks of the virus. The condition causes newborns to be born with a small head, or have heads that stop growing after birth. If the smaller head affects brain growth, it may cause developmental disabilities. Currently, health officials are researching the possible link between the Zika virus in pregnant women and the increase in cases of microcephaly. It is recommended that pregnant women in the affected countries take extra precautions to avoid mosquitoes until more is understood about the virus. The World Health Organization has drafted a $56 million strategic response plan to provide surveillance of the Zika virus, control the spread of the Aedes mosquitoes, and support vaccine research. And that's the bulk of what we know so far. A lot of research must still be done to further our understanding of the virus and take steps towards developing a cure.